Let's get a few extra headrests if we want to bolster her ankles. Let's get that. You might want to bolster. You don't have to, but you might. So when we do bolster, we want to help protect the joints. And this is the injured one, right?
Yeah.
What, is this abandoned? What is this?
No, that's my sock.
Oh, that's your sock. Okay, that's fine. I just want to understand it.
It's on the dorsal side.
Yeah,
of the
so
foot.
sometimes if they look like they're flat, we might not bolster, but this one clearly, right? You see how she's lying here, and you see this looks uncomfortable, right? This is when we think about bolstering. If they're just lying out flat, you know, and they look relaxed, but clearly she needs some help here. And so we want to fill in the joint. So we could do it a few different ways. We could do it this way, we could do it this way, you could have a rolled up thing, anything, right? Okay. And we want to make sure they're comfortable. And I think you're comfortable, yes? Christine's comfortable? Okay, so I have to scrub. I'll be back. I'm annoyed with you and I'm shutting you down. There you go. I'm sure you don't mess with me. So they want some kind of rolling. Let's see. You know, I'm more inclined to push. I tell you the transition I like after you've done the back work, I like to push. So let's try push. And if we're going to roll, it just seems silly to me to roll. This would be the rolling. I mean, I can get one side at a time this way. Doesn't seem like much of anything. I don't know, Christina, is it much of anything? It's not really much of anything, is it?
Not really.
Not really. Let's push. Let's push to transition, okay? We're gonna push, and then we're gonna come down and start our palming sequences. Go. I like this, I think it's a better transition. Yeah. I think a little fist roll over the iliac crest is a nice idea. We don't have it in the thing, but I think we should try. Can we take your arm off? Go. Yeah, we want to move this way, yep. I like that. That's a nice one, yes, Chris? We like this one. Yeah. So let's make this our transition, okay? We're gonna push. We can push, and then we're gonna come down one side. We're gonna push. We're gonna push, and then we come down the other side. And then we're gonna go into the sequence in your supplemental, which is gonna be a series of flat palms. First one is gonna come down the middle. The second one is gonna come around the side. Okay, so push and roll. And then push and roll the other side and move around. This I think is a better transition. Very nice. We're thinking about creating this movement coming across above the posterior sacroiliac, above the iliac crest. Very nice, Tim. Think about whole body. Try to think about whole body, not so much coming with force from your shoulder. There you go. Go, go. Very nice. Did we do this side yet? So move around to this side, and then from this side, we're going to come down, we're going to put in our palm press. One, first line around the sacrum, and then right down the middle. The second line is going to come around the trochanter. We're thinking gallbladder now, right? I like that. I think people will like that very much. Very nice. And go into the palm series. Find the sacrum, line up right outside the sacrum, and we're going to come right down the middle with the palm. And then the second line is going to come around. You decide which hand you want to use, doesn't much matter. Come around with the flat palm. And then we're going to come with the heel of the palm. Heel of the palm, right? First one, flat palm, remember? And the second one going to be heel of the palm, down the middle. Heel of the palm, down the outside. And then, oh, we forgot the inside. Just do the outside, sure. Yeah. Just in the knee lunge. It's very simple lunge. So I like to go hand over hand, but in the supplemental they don't. Supplemental just using one hand. So this first one come from the sacrum, come to the middle glutes. Just come right down the middle. You fall in and fall in. You could change this way if you want. Fall in, fall in. So they do maybe 3 of them. So we come from outside the sacrum, down gluteus maximus, sciatic notch, fall in. I like the 2-hand, but you can do however you like, right? So we can do maybe 3 of those. Yeah, whatever's comfortable. Just fall in, whole hand. Do maybe 3 of them. Just to the knee. We're going to do the bladder channel to the knee, the gallbladder channel to the knee, then we're going to do the kidney channel. Flat palm. Flat palm. Center of glutes. And down, fall in. Just fall in until she stops you. And then next one, fall in until she stops you. Whole hand, come up wide. Yeah. Whole hand. And just to up behind the knee, that's it. So 3 lines this way, and then 3 lines going to come, same starting place, but now we're going to come around the trochanter and down the outside. So you decide how you want to do. Maybe you want to do this way, right? Because we have to come down gallbladder now. So you decide how. It's always the same. You fall in until she stops you, and then you move on. Fall in and then move on. There you go. Just one time. Just fall in and then move. You don't have to come too tough. Just to the knee. It's just stop with the knee. And now we're going to also come down the inside. 3 times. Flat palm. Now next time, same lines. Next time, same lines with bottom of palm. So it's going to be a little deeper. It's going to be the same lines, but a little deeper. 3 times, and then around the trochanter 3 times with the base of the palm, and then down the inside. And then it becomes kneading technique. Three times kneading down the middle. 3 times kneading around the trochanter. And 3 times down the inside. And then if you want to, you can come in with forearm. Yep, so it goes press, knead, and forearm. Yep, just keep going. We're ready to the pressing. Come in with the kneading. Yep. I'm thinking bladder channel, right down the middle, or the gallbladder around the trochanter. You may also want to use this one for the kneading. You decide what you want to do for the kneading. The forearm would be the last. This way probably. Yep, keep it moving. Keep it moving down. You could also do this one when we're in gallbladder. You could do it more from a lunge, falling from the side and come around for more of a lunge, depending on what you feel works. Keep it moving down. Keep moving down the channel, down, down. There we go. Nice. Very nice. Stop at the knee. And now inside, just from about here. So usually on this side, I use the inside of my hand. I use this part for the kidney. There you go. Go, go, go. Go, go, go. You know it's got a little bit of speed to it, right? No. Stop at the knee. Only to the knee. Great. Muy bueno. Am I leaving out anything? I don't think so. That's it, right?
Urinary bladder check.
That's down the middle. There's no points until we get to the end. I don't think, I need the supplemental.
The press is there.
What?
The press, all the press.
We did the palm presses, you just weren't paying attention. We did. Squeezing. We have a squeeze. We're supposed to squeeze before we need it. Doesn't matter. So, palm press, right? The palm presses, the different, and we do a fist press. The palm press the channels, bladder, gallbladder, kidney, right? And then we added the kneading, but we should have squeezed first. This is squeeze. It's very simple. Squeeze, squeeze. Very nice. Keep them to maybe like 5 of them. So 2 more. Now they want a squeeze that emphasizes. So just like to squeeze down urinary bladder, squeeze gallbladder channel. It's a question of emphasis. So you have a squeeze where we're even on both. You have a squeeze where you're falling in more with the outside hand. You have a squeeze where you're falling in more with the inside hand. So this one, right? This bladder channel, my thumbs are bladder channel, right? This one, you're kind of falling in and squeezing, kind of thinking gallbladder. This is more like gallbladder. And this one, obviously not too high up right about it. This one more kidney. So it's still the same squeeze. But in the first squeeze, we're falling even into both. This squeeze, I'm coming in more on the outside hand. And this squeeze more the inside hand. There, that would be the outside hand, but think more about gallbladder for the outside hand. Yeah, a little more coming in into the, yeah, that would work. You could do that way. That would be all right. But you're a little kind of bent over. Needs to be a little. Yeah. You can do that. That's one way to do it. Another way is to think about, like the 2 hands are the same. This is bladder one, right? Coming right down the middle of the bladder. Now I'm going to keep the basic hand position, but just falling from the side more. It's more like falling in from the side. That's it. Yeah, I think that might be easier way. Yep. Yep.
Gallbladder?
For gallbladder, right? Just falling from the side.
Oh, urinary.
Well, no, we're going to use this for urinary bladder because of where our thumbs are. For gallbladder, we can use the same hand position, but falling from the side more. Yeah, don't worry, yeah, just going to come down. So now I'm coming in more from the side, right? Well, let me come to your side. So on your side, it would look like this. First one, going to come right down the middle. Second one, going to come more from the outside. It's all basically the same thing, except now I'm coming on the outside. It's almost like the press. The only difference is there's a little bit of grip. It's pretty much like the press, except you're lifting. So it's more like, what's the angle to
Where's
come
the
from?
pressure highest? When you do the gallbladder?
Yeah.
Where's the pressure
Oh, in my hand,
On the palm. Oh, oh, oh.
it's both. It's both. See the two high places, right? The two high places, this high, this high. It's both. It's a good question, though. Yeah. Mm-hmm. Yeah. It's almost like the press, except there's a little bit of squeeze. Maybe even, watch, coming back up, your hand back up. Maybe a little more down towards it. There we go. Now I think we got it. Yeah. Mm-hmm. Absolutely. I think that's fine. I think it's excellent. Stop at the knee. I know you want to finish it, but we just go to the knee with these. Okay, so with that, we skip the squeezing. Okay. And now kneading, right? We did the kneading. Okay. Squeezing from the knee to ankle. You can do right along with me. Same thing, but close your hands up. Now close up. So this one is like this way. Mm-hmm. Same thing, just fall in. We use your body weight 5 times. Which is the injured one? This one?
Yeah.
Are you sure?
Yeah.
You let me know, okay? So we can go right just up to the heel with this one. So that's our squeezing. Just squeezing. Well, so this is what they've got here. We're going to add something, okay? What they've got here is this one. And then when you get to the Achilles, they want you to kind of do a pincher thing. When you get to Achilles. So it's going to be this one. And then this one. Right, just a little bit of a, yeah, for the bottom. Because there's nothing to squeeze anymore. So here, and then this one. But you know what? We should do this one first and do the pincher later. Let's do this one. But I think we need to add some kneading, okay? As a matter of fact, I know we need to add some kneading. So we got the middle line. We've got the lateral, the lateral line. This comes from the outside. And we got the inner line. You use the inside of your hand. The inner line, the middle line, the outer line. Now you can come with your squeezing. Just a little squeeze and lift. So we get a little bit of it. You can start to feel Achilles. Maybe about here you can start to feel the tendon, right? Yeah, right? So when we can start to feel the tendon, we can run a squeeze. So we get maybe 1, 2, we're going to get maybe 1, 2, 3 squeezes, something like that. That's pretty good. Now they want the points put in now. They want the points put in now, but I think something else should happen. You see this one here? Some kneading around the malleoli. I think before we put the points in, before we put the points in, we should knead around the malleoli. You can use your finger pads.
The bony prominence?
Yeah. We want to come around the bony prominence. You can do one side at a time. You had this from Swedish, right? The same thing. We just want to try to, are you okay? Okay, Chris?
Yeah.
We want to try to come all around the malleoli with the kneading. All the way around. Direction doesn't matter. We get under them, right under it, where the malleoli is on the arch underneath, behind it, around it. I'm wrecking her burn, messing up her scar. Sometimes for the inside part, you can stand up like this, come around much, and reach over from the other side to get the inner one. Yeah, right? That's a pretty good contact. You get all around. I try to make it easy on my body. See, this way I can be up straight. I can be up straight and I can fall back in my finger pads a little bit. So I still have body weight, my body weight coming back now. So this gets the inner malleolus very well. All the way
Rapid
up, all the way
response
up.
team, please report
And now
to
the outer
16
malleolus,
South,
I get kind of with my thumb maybe.
21H.
Yeah, something
Rapid
like that.
response team, please report to 16 South, 21H Harry.
Now the other thing I want to do here is I want to just stretch the ankle, dorsii and plantar. So what I want to add here is before I go to points, I'm going to make the points last. Okay, so I'm not doing the points, I'm doing the malleoli. You could even bring them up to do the malleoli if you want. You could, right? Do the malleoli, then I want to do some simple dorsiplantar, 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 and maybe circumduct. I want to add the ankle joint movement. Then I'm going to grab for points. So we're going to make some changes. We're going to put the points at the end. And after the thumb kneading, we're going to do ankle range of motion. Okay, I wrote it